Okay, guys, let's talk about today. We're doing our in-service in assisted living, and we're gonna do our in-service on transfers, and we're also gonna be using these Hoyer lifts to kind of just show our assisted living staff how to use them during a fall. But more importantly, we're gonna talk about how to protect your back when you're doing a transfer.
Forget it.
And
it's too late. I
it's
have
too
a
late.
pain now.
Yeah. So I'll give you guys some pointers on how to be efficient when it comes to doing a transfer, and how to kind of communicate with your coworker. Okay. Okay. So preventing back injuries. There's some like really significant numbers here when it comes to your back, ladies. When it comes to transferring a resident. When you hurt your back, unfortunately, because you only got one back, there's very little circulation in your back. If you do the wrong thing, you do the wrong move, you're gonna hurt your back, and it's always gonna hurt. Okay, I hurt my back one time, so I've always had pain there. Okay, and that's because the makeup of your back, there isn't a lot of circulation there. So if you break something or if you twist something, you're always gonna have back pain, unfortunately. Okay, so the best way to protect yourself is really to do the right technique, which means if you're doing transfer, you're gonna have to bend from your knees and not from your back. If you're going like this and you're picking stuff up, you're gonna crack your back. You know what I mean? So when you are lifting, you want to bend your knees like this, and you want to use your legs to pull up. Okay, that's gonna help you with your back, but also that's gonna prevent injuries for your resident. Okay. It says here back injuries account for 25% of all work-related injuries. Healthcare workers have the second highest back injury rate in the country. Only construction workers have more. What does that tell you? You know, there's a lot of education that we can do for our staff. The fact that we're right there with a construction worker. Think about what construction workers do, right? They're lifting all the time. Okay, they have a significant amount of back injuries, but we're right there behind them. You know, as healthcare workers, as nurses, as caregivers, as CNA. So we need to be doing the right thing. There's a couple things you can do to protect your back, ladies. 2% assist is gonna really help you. Okay, as I mentioned to the ladies over here, that if you hurt your back, you're gonna have a back pain like forever. It doesn't matter how young you are, if you're 18, 19, or 20. If you hurt your back the wrong way, you're gonna be living with that back pain forever. Okay, 2% assist. Use a gait belt. If you guys, if you don't have a gait belt, there should be some transfer boards in there. But if those are not available, like I said, 2% assist is really gonna help you transfer. Okay. There's also a technique that physical therapist has shown us on how to do transfer. I'm going to use Letty real quick. Okay, Letty, you go ahead and sit down right here, Letty. Sit down right here. I'm going to show you guys how to kind of properly lift a resident who has minimal ability to help you, right? So there is a technique where we use, if the patient has good knees, right, you want to be able to kind of use that knee to kind of guide you, okay, when you're lifting, okay? But if you use this position right here and you're lifting a resident, we're going to use Letty here. If you make sure like you have one knee here and your knees right here, and the other one is kind of supporting so she doesn't kind of buckle like this. So, but if she's like this and you want to lift her up, make sure your like back is nice and straight. Okay, you never want to go like this and you're lifting her up. If you're having to do that, you probably need 2%. Okay, like I said, your back is really important, and you could be out of work for a very long time, if not forever, if you hurt it the wrong way. Okay, so physical therapist has always kind of shown us how to transfer a resident. You want to use this, basically if you kind of nudge this forward, it'll push that resident up. When you bring this resident up, if you're able to, you can push that knee up, and that kind of bring the resident up, but also you want to keep your knee kind of like right there to kind of help her. If she doesn't help you guys, 2% assist is going to help you. Okay.
Because in the 3% they can stand on one person in there right now. Because that's why I have to use that one.
The easy stand. Okay, I'll show you how to use the easy stand and how to use that correctly with 2%. Okay, and being efficient. Okay. The other thing is you want to use a gait belt, because you never want to just pull somebody in their pants. You'll rip their pants. If that kind of rips, that puts the resident's safety at risk as well, and your safety, right? So use a gait belt because you won't rip it. Okay. Also, it prevents skin tears and bruising. If you're grabbing this resident who's on blood thinner, who's 89 years old, has kidney issues, has cardiac issues, if you go like this, they'll have a bruise. Okay. Now, this bruise may not be significant 99.9% of the times, but if the patient is confused and she's saying that, hey, you know what, somebody abused me, and look at all this bruising that I have, that can go against you. You know, that can go against everybody. So bruising, like I said, 99.9% of the times is not an issue. But when it is an issue, it's gonna haunt us later on. Okay, so be careful with your resident in terms of the tissue because they're frail. Any kind of nicks and bumps is basically gonna go ahead and might cause a skin tear. Okay, even just bumping like this is gonna cause a bruise, and that skin can just fall off and have a skin tear later on. Another bump like that is gonna be a skin tear. Okay. If you are if you do injure yourself at work, make sure you are reporting it. Okay, you're reporting it. You're telling HR. You're making. You know, you guys are familiar with the red folder for injury. If you hurt yourself, there's a red folder that you fill out. Okay, and that could be educational purposes, so we know how many people are getting hurt with transfer. But also, it's gonna help you later on. It's gonna help you later on when you need help, you know, from bench press, right? So make sure you're filling out these forms with your manager, and then that HR is aware that you got hurt, okay? Because it's for your, literally, it's for your own good as well, okay? In terms of trying to report this, okay? What else is in here? Okay, so we talked about body mechanics. Let's talk about these lifts right quick here. So the most important thing with these lifts, ladies, is that your coworker is probably going to be like, hey, you know, what's your name, ma'am? Morelia. Maybe Morelia is calling all the time, right? It's like, man, she's calling all the time, man. Like, I got to go over there and help her. That can make them unhappy, right? So here's the thing with the Hoyer. They do take a long time. They take more of your time. So even though you want to use it because it helps you, sometimes, you know, caregivers and CNAs just don't have the time to keep, like, you know, open this up and doing all this. But not only that, your coworker is going to say, hey, you know what, why can't you transfer on your own? Here's the thing with these machines. It has to be two-person. Okay, if something happens with this machine, the resident fall down, if this breaks, you could get in trouble for it. Okay, but if there's two-person there, you know, at least you've taken the approach for safety. Because if the recommendation is two-person to use this machine, at least you've taken those precautions. So the way to kind of get around your coworker so they don't get as uncomfortable as much as possible is that get your resident ready. You know, comb their hair, put their shoes on, put their clothes on. You know, get this underneath them, and then get them ready for transfer. So that way, when you're calling, let's say Marilla, when she called Letty for assistance, the resident's ready. Letty doesn't have to go there and, oh, I gotta help you brush your teeth, I gotta help you put your shoes on, and then now I gotta help you transfer, right? So get your resident ready. That's gonna be really important when it comes to, like, you know, teamwork, right? So you don't agitate or get your, you know, coworkers kind of like frustrated, okay? So the way this works is that this kind of slips underneath the resident, okay? And you can use this for a fall too. Right, if a patient fell down and it's at the bottom of the ground there and you can't lift them up because, you know, it's in the middle of the night, it's 4 o'clock in the morning, there's only 2 female CNA. Who's going to pick this resident up? You're calling 911 and nobody wants to come in and try to help you. You can use this machine, okay? This right here, just going to show you here, the TV here. The bottom, the resident's bottom basically goes underneath, kind of like right here, okay? So they need to be sitting on that, like right here, at the bottom like that. Okay, if you put it kind of like at the top right here, their bottom is going to fall through, right? So kind of like put this right here, just like that, so it's kind of like lifting that resident, okay? So as they're in bed, you want to put this on. Even if they're in their chair, you can safely put this on a resident, okay? So what you want to do, have you guys used this before, right? The Hoyers, right? The easiest way to do this, you want to crisscross this to make it safe, okay? To make it safe like this. All right, crisscross it for a Hoyer, okay? And then, you know, you put this just like that, and then now you have a nice, you know, Hoyer lift right here. You can lift up and down the resident. Okay, where this thing is gonna help you during a fall in the middle of the night, if the patient is heavy and you can't get them up, is that this machine can actually go all the way to the floor. So if a resident is on the ground, you can put this on them while they're on the floor, right? The same way as you would while they're in bed. And then as you're putting this on them, right, you can lower this all the way down, right? All the way down, and you can pick that resident up from the floor. Okay? So isn't that much easier for your back and your arms, right? So you don't have to call 911. You have a machine right here. Obviously, after a nurse kind of assess the resident to make sure that they didn't, break any their neck or whatever, moving them around. Somebody who fell down and has a neck fracture and you move them around, that might make it worse. So that's why if somebody falls down, make sure a nurse is kind of like assessing them, or somebody is trained to do so, is assessing the resident. Because if they broke a hip and you move them around and you put them on this, it's gonna snap that hip even more worse. Okay, it's gonna make their neck injury that's gonna be even more worse. So have somebody assess that. If you're not comfortable, let's just say you move the resident on the ground, they're having to yelling and screaming because they're in a lot of pain. You should probably call 911 at that point. Don't put them in here, okay? Because likely they broke their back, they broke their hip, they broke their neck, and putting them in here might make it worse. Okay? Have somebody, your supervisor, make a decision whether you can put them on here. But think about what this can do for your resident, what this can do for you in terms of your ability to move this resident from the ground, right? Right? You get them, you put this on them where they're on the ground, and then you can bring this resident up. See, this goes all the way down. All the way down. Okay? And now, you don't need 911. Yeah, a lot of times we call 911 for transfer. You don't need it for transfer. Yeah, we call it all the time, right? When somebody falls down on IL, people will call 911 for transfer. Have you guys, who's done that before? Have you seen that?
Me.
Right? So yeah, because there's nobody there. And there's two girls there working at night and they can't get this resident on the ground who's 300 pounds. Okay? But this is gonna help you. Okay? So in terms of Hoyers, this is gonna be very helpful, but you gotta do it the right way, guys. One of the most important thing is always have two-person to help you. And think about your coworker. Get your resident ready first. All right, and then the proper way of putting this resident in here. Make sure this is at the bottom of their kind of meats right here, so that they're safely on there. Okay, and then both legs are coming out here. Okay, obviously if their legs are hanging out in here, they're gonna fall through. Okay, so make sure you're doing it the right way. And there's also pictures in here on how a resident should look like. Okay. Any questions on the Hoyers on how to do that? Okay. All right. So. Also, guys, the easy stand, you guys are familiar with the easy stand. What's the most important thing about the easy stand? On who you can use this resident, who you can use this? What kind of resident do you think you can use this on?
I use it for don't moving.
Huh?
They can move it, the resident.
They can move? So let's just say the resident like only uses one hand. They can't use the right hand. Can you put that resident in here safely? You gotta be, the resident who's using this has to be able to grab onto this. Okay, they gotta be. Otherwise, it's dead weight. They're gonna fall down, right? If they're able to do that, you can also use this machine to kind of change the resident's pad. If they're difficult or whatever, but they can hold on to this. You can change their under pads, right? So also using the bathroom, right? They can grab onto this and pick them up and put them in the bathroom and move them around. But the safest way to use this is make sure that the resident is able to kind of grab on, and then they don't have like their knee like would buckle, right? It's okay if their knee would buckle because this will help you, but if they totally have like a dead weight on their foot, that might not be an appropriate resident for this machine. And you might want to use the Hoyer, or you might want to use two-person for transfer. Okay, so and one of the main reasons why I wanted to come over here was really for safety for you guys, your back, but also because you guys have been getting a lot of like skin tears and a lot of skin issues in your area. Okay, and if you really think about how residents get these skin issues, it's really a lot of it has to do with showers, when you're moving around, transfers, putting them in a wheelchair, and you're actually bumping their feet. You and I, our tissue, look at how nice our skin is, right? It's nice, and we're hydrated, we're drinking well, we eat a lot of protein, we're young, so when you pinch it, it bounces right back, right? People that are in your area who you're taking care of, that's 80, 90 years old, they're not drinking enough fluids, they're not getting enough protein, right? Their skin is like thin, right? They may even have edema. So at any point in time, if you like bump it in here, it's gonna be bruised and bleeding. It's so easy to do that. You know, and I think we need to realize that when we're doing transfer, sometimes we're in a hurry, we're just kind of moving resident around. Just remember, anytime you like hit your hand through the skin like that, it's gonna be a bruise. Because for one thing, they're probably on a blood thinner. You and I are not on a blood thinner, you know. So these residents who's not moving around, they have to be in a blood thinner, or else their blood is gonna clot. They're gonna have heart attack. They're gonna have, you know, stroke. So they have to be in this blood thinner. Unfortunately, being on that puts you at a high risk for bruising and skin tears. Okay, because it makes you blood thinner and you can bleed out easily. Okay, so any activities will put these residents at risk, especially doing showers. So if you're doing transfer from like from the bed to a shower chair, from the bed to a wheelchair, from anywhere, any kind of movement with this resident, you know, will put that resident at really high risk. Okay, so one of the things that you guys can work on to kind of decrease the skin tears and bruising in your area here in assisted living, increase fluids, do more range of motion, but definitely pay attention to the transfer. Get 2-person assist for any resident that are aggressive or yelling out or combative. Okay, because not only that's good for you, but it's good for the resident. And then if you have any issue later on with this resident, at least you have 2-person. 2-person is always good, because if you get into a hot waters where the residents say, hey, you know what, they were trying to throw me around in there with the transfer, I don't know what they were doing. With 2-person, it's a lot easier to kind of say, oh, you know, these nurses are you know are safe, or they didn't do what the resident is claiming to be, because there's 2-person there, but it's just you, and you continue to have those kind of complaints from resident, that might get you later on. Okay, it's a thin line when the resident starts to complain of you know, abuse or whatnot. Okay, and a lot of these are not abuse, guys, but it's just because the resident is confused. They might, you know, complain about you sitting care. We deal with that all the time. We have self-reported here in Goldberg. State comes in and they investigate, and like I said, 2-person is always better than 1. And I know it can be very difficult here because of staffing. You're trying to call 2-person, you're not trying to do 2-person. There's only 2 people that work here. You know, so how are we trying to do that, right? But don't be afraid to call your supervisor and just say, hey, you can just be here for a transfer because, you know, this person is very agitated. I don't want to get in trouble for this. Okay, especially if they're combative. Okay. So any questions on transfers, or do you guys have any suggestions at all on how to help others on transfers? How about you, Letty? What are some of your experience in transferring? What are some of the things that you personally do to kind of help you with transfers? Right? Let's just say a patient is bed down. How do you get them to get up if you're on your own? Right?
Well, I never try to hold them like this, because I'm, like you say, about the bruises.
Yeah.
I always hold from right here, but
okay.
not with my hand, right here.
Right.
And what else? Yeah, make sure, like you said, put my knee on in the, right here, so it won't
buckle.
Yeah.
Yeah. Okay. Let's just say that this is the bed right here, right? The patient, this is the head and this is the feet, and they're laying down. And then you have a wheelchair. How would you position a wheelchair to kind of transfer this resident? So this is the head of the resident, and this is the feet, and then you have the wheelchair. Would you face the wheelchair this way, or would you face the wheelchair this way? Would you back it out like this and you transfer the resident? What's the safest way to kind of bring that wheelchair in so it's safe for you guys? What are some of the things that you would consider?
Put it like L. We put it on
The wheelchair would go that way or go this way?
This way, like
That's
that.
right. Yeah.
Mm-hmm.
Okay. All right. And then what about the bed? Like, do you wanna higher or lower than the wheelchair? How would you position the bed?
The higher. Up,
You
like
want the
that.
bed higher, right?
so it can go straight to the
Yeah.
chair.
Mhm.
That's right. So you want the bed a little higher because you want the bed kind of like in your
Yeah.
height, right?
Mhm.
So you're not lifting so high. If they're down here, you have to go down and you have to lift them up, and then now you're bending your back. But if the bed is kind of like in your waist, right? So now I know you can't use their knee, but with 2-person or whatever, hopefully this person is still able to kind of stand up. You can just guide them and put them in the wheelchair,
Yeah, watch out.
right? So never bend your back.
That's too hard because
yeah.
we have a 2 person in one side. It's very. They have a lot of weight.
Yeah, you have to
It's
get them
so
up. It's
hard.
difficult. It's very heavy.
It is.
Yeah. So, and hopefully it's being care planned. You know that their behavior and they're heavy or whatnot. Do you guys use gate belt?
I use it, but doesn't matter. It's the same because the people here don't help us. If you talk to them, they can you
Oh,
help
yeah.
me? I help you, and they stay like that.
Yeah.
And then if you talk to, hey, can you stand up
Yeah,
for
yeah.
me? Can you help me?
And they look at you, yeah, because they're confused. Yeah, yeah.
Yeah, they're confused.
What about a slide board? You guys use a sliding board? No?
No.
Okay. So, you guys
It's
do
so
two
hard.
transfer a lot then, right? 2-person CNAs and caregivers, you just
Yeah,
do it
we
on your
do,
own.
but it's the same because
Yeah.
it's too hard.
But a lot of them are, they are able to stand up though, right? They have strong legs still, or?
No, we have to do everything for her because they don't help us, right?
Yeah.
Actually, right now I put it in the piano room.
Yeah.
Because we have to put it in the level legs because
Yeah.
she needs for the prescription for the doctor. And then don't help us nothing. We have a stand up her because
Yeah,
she
yeah.
don't help us
She
for
don't wanna
nothing.
grab the walker.
She
She
don't want to grab the
can,
wall.
she don't do
Oh,
nothing,
okay.
so it's so
And
hard.
she's very heavy.
Yeah. Well, I mean, you ladies have a big challenge, obviously, in your department. I know David is trying to get some of those residents in our area once they get to be very difficult. But the only thing I can tell you is try to get a gate belt, try to get a support back, you know, like some kind of brace on your back, so that way when you do bend, it keeps you back straight. So especially if you can have it on your back and you don't have to kind of tighten it up. You can tighten it when you're doing transfer. Have you seen one of those back braces before?
I use one resident. I use the girl.
The gate belt? Yeah. But there's also like a back brace that you can use as a staff, where you just have it on like a backpack, and then when you have to transfer, you make it tight. So when you do have to bend back like this, it keeps you back straight. Because this is what you want with your back, right? You want it straight when you go like this. But if you don't have the back braces, sometimes you go like this, and then now you're lifting with your back. All that weight is being put on your back.
It's so hard.
You know, and that's how you get those back pain. You know, those soreness, right? You pinch your nerve. Once the pinch nerve happens, you kind of have it's uncomfortable forever. You know. All right. Any questions about anything, ladies?
What is the machine though?
This is where
But it's in the what side? In the
we have 3 of them in Goldberg. Yeah.
But we don't have it.
You
Here,
don't have
only
one,
that
okay.
one.
Yeah. So I would use this if somebody falls down and you need to pick them up. Just come over to our unit and borrow one of these
Okay.
Hoyer lifts.
Okay.
Okay. So but that's what I would do. It's if you have somebody on the ground and you have to like pick them up, these Hoyer lifts are going to be really essential and going to be helpful. Okay. So any questions about anything? All right. Should we go over this test real quick here? All right.